Hi friends, let's talk about when to get angioplasty done. So there are two specific situations. The first situation is if someone has an acute chest pain, and the second situation is if someone has been having chest pain with exertion for many weeks or months. So let's talk about the first situation. If someone has acute onset chest pain, which feels like deep pressure with radiation to the arms, and we are concerned about a heart attack, then we obtain two tests. The first one is called a blood test, which checks troponin level, which is a marker of cardiac injury. And the second test is an electrocardiogram. Based on these two tests, we decide if you need angioplasty or not. And if you do, under what timeline you need the angioplasty done. So, if your troponin is positive, the blood test is positive for cardiac injury, and we see a high risk marker on your electrocardiogram called ST elevations, then we recommend that you get angioplasty done as soon as possible within 60 to 120 minutes. That is within 1 to 2 hours. It is an urgent situation and we want to save as much of your heart muscle as possible before it becomes dead. The second situation is that the marker of cardiac injury called troponin is positive, and we do see some changes on electrocardiogram as well, but we don't see the high risk feature on electrocardiogram called the elevations. In this situation, we call it non-ST elevation MI, and we still recommend that you get an urgent angiography and angioplasty within 24 to 48 hours to save as much of the cardiac muscle. The third situation is when the blood test troponin is negative, but the electrocardiogram is positive and we see some changes. We call this unstable angina, and similar to non-STEMI, we still recommend that during the first 24 to 48 hours of presentation, you get an angiography or angioplasty done. Now let's talk about the second condition in which you have not had acute onset of chest pain at rest, but for the past few weeks or months, you have a predictable onset of chest pain with exertion, physical or emotional stress. In this situation, we call it stable angina. In most cases, for most people, we will first recommend a stress test, which could be an exercise stress test or a nuclear stress test. And depending on the results of the stress test, we either classify it as high-risk features on the stress test or low-risk features on the stress test. If you have high-risk features on the stress test, which show that a large part of your cardiac muscle is not getting enough blood supply, then we still recommend that you proceed with angiography and angioplasty if needed as soon as possible in the next few weeks. But if you have low-risk features on the stress test, then we may recommend that you start medical treatment with medications such as aspirin, statin, beta blockers first to see if this will be enough to help with your symptoms before actually needing angiography or angioplasty. I hope this helped to clarify when to get angioplasty done. And if you have any further questions for me, please feel free to comment. Thank you.